Penicillin is a group of antibiotics. Okay, there is like antibiotics and antiviral. So among antibiotics, penicillin is a bigger group. So inside the penicillin group, we have ampicillin, amoxicillin, socin, ticard. So there's a load of penicillins. So penicillin is usually used against infections like after we detect the bacteria and before prophylactically also we are using penicillin. So penicillin, when I talk about penicillin, so it how does it work actually? So if you have an infection, or we suspect that if you have an infection, then there is a cause. Okay, the causative factor can be bacteria, can be viral, can be fungal, so it can be anything. So we don't know. So first of all, we take a blood culture. So we need to take a blood culture from the patient before we start any antibiotic, because we cannot get an accurate result after we start antibiotic. So after we send a blood culture, we are going to start an antibiotic. So there is going to be narrow spectrum antibiotics and broad spectrum antibiotics. So this is same for penicillin as well. In among the penicillin also there is going to be narrow spectrum antibiotics and broad spectrum antibiotics. So let me explain you how this is different, how we can differentiate between this. So narrow spectrum means like we are specifically targeting one single bacteria, and the broad spectrum is like we don't know what is the bacteria is, what is the specific bacteria causing it, but we can know there's like a specific group is causing. So that way, like if you're giving broad spectrum antibiotics, it's gonna kill a range of bacteria. It can the good bacteria are can also be included in the bacteria group that is gonna be killed by this penicillin, broad spectrum penicillin. Okay, so narrow spectrum means like it's going to target the specific bacteria and it's going to kill the specific bacteria. So none other bacteria are going to be get killed by this penicillin or destroyed by this penicillin. I mean, by narrow spectrum penicillin. So penicillin we usually give like prophylactically. So we suspect infection in a patient and we start, we get the blood culture. After that, we start prophylactically. We start broad spectrum or extended spectrum. So broad spectrum, it's the same like broad spectrum. It can have a wide range of more bacteria can be affected by the bacteria by the extended spectrum. That's all the difference. So just remember the narrow spectrum and broad spectrum. That's all. So broad spectrum and extended spectrum bacteria, I mean antibiotic, they do the same thing, similar thing, because just extended spectrum can destroy couple of more type of bacteria. That's all. So in infants or like in newborns, we give like ampicillin, amoxicillin, gentamicin. I mean, not gentamicin is not penicillin, but we give ampicillin and amoxicillin in the babies, like in the newborn babies or like premature babies, like that. Also we give what is it called, we give socin, piperacillin, tazobactam, socin for adults, prophylactically to destroy that kind of bacteria. So after we get the 24-hour preliminary blood culture result and the 48-hour preliminary blood culture result, we can change to a narrow spectrum antibiotic. Other than that, we cannot do it. So it's all depends on the blood culture result. So how do we know the patient is okay? We are going to administer a penicillin, and we're going to the room, and then we need to ask them, have you ever had penicillin before, and have you ever had a reaction to any antibiotic? Usually they will tell you something, or if they don't remember something, if they tell you something, it is a best practice, because that can help you to prevent an anaphylactic shock occur to that patient. So that is very helpful if they remember something. So usually if they are allergic to cephalosporin, they are more likely to be allergic to penicillin too. So just keep that in mind as well. So how do we know? Okay, we started administering the penicillin. We check the patient, that is the right patient, that is the right dose, that is the right drug, that is the right time, that is you did the assessment and everything is okay. If there is any blood culture needs to be sent, you send the blood culture, everything is okay. So we're going to administer the penicillin. So how do we know they are going to have a reaction? So Within 5 to 10 minutes we can actually see a reaction occur. So they kind of start itching. Some people itches, some people have like rashes, some people have hives, some people have difficulty breathing. And if it's difficulty breathing, they're going to be in anaphylactic shock. That means they have to get epinephrine stat. We need to call rapid response team, and the doctors and nurses team, the rapid response team needs to be there and help the patient to recover. So within 30 minutes we can know that. So it's better practice to stay there like for 5 to 10 minutes, and then go back and check in within 30 minutes, or ask them to call you guys, call the nurse if they feel like itching, hives, redness, flushness, or something like that. It's the same case for blood too. So for the blood we need to stay there for first 15 minutes. That's the difference. So this is like, also we can monitor the vital signs also. Like, I mean, it's not penicillin is not like serious as like when we administer blood products, but still if they're going to anaphylactic shock, we need to prevent it. So it is always better to keep monitor them when we start penicillin for the first time. And also, like, how do we, so what is the side, okay, if they're okay, they don't have any reactions, okay, what is the next step we need to monitor? We need to monitor their electrolytes, how their electrolytes are affected, how their kidney is working, if there is any problem with kidney, if there is any problem with bleeding, if there is any problem with cardiac output. Because some penicillins like ticard, they can actually affect the platelet function, and then interfere with that, and then they can cause bleeding. Some can cause cardiac overload, some can so we need to actually monitor their blood pressure, their PTT, whatever it is, electrolytes, their cardiac functioning, kidney functioning, etc. So if you're giving like two antibiotics, like I said, gentamicin, like aminoglycoside, or like penicillin together simultaneously, you cannot push it through the same IV site, or you cannot give it simultaneously through the one tube, because why? Penicillin is gonna deactivate aminoglycoside, so patient is not going to get anything from aminoglycoside, so that's going to inhibit the purpose. So that's going to kill the purpose. So we cannot do it simultaneously or together in the same tubing or anything like that. That's going to cause, or at the same time it's going to cause the negative effect. And what else I need to say is that we need to monitor them also. So when the blood culture comes back, we need to let the doctors know as well. So that is the main things we need to be considered whenever we are giving penicillin. Can be, we can give penicillin if we suspect sepsis, syphilis, septicemia, whatever, for a variety of infections. And also so if they have like side effects like GI distress, rash, anaphylactic shock, we need to be concerned. And also the electrolyte imbalance, cardiac functioning, and kidney function. So keep that in mind. Also a tip is, like, if you see an antibiotic ending in CILLIN, you can actually relate it to penicillin. So that can help you in NCLEX RN exam, because we are reading a completely strange name, and then we don't know what kind of pharmacologic or antibiotic group is it. So if you see CILLIN, you can actually relate it to penicillin, and you can know, these are the common side effects of penicillin, even though you don't know the specific penicillin medication. So that is all the tips I have for you guys. So keep watching, and if you like it, subscribe, comment, I do appreciate that. And also you can click on the bell button next to the subscription, so you won't miss any videos from me. So good luck. Thank you.